Major depressive disorder. This condition involves a persistent low mood that lasts most of the day, nearly every day, for at least 2 weeks, along with a noticeable loss of interest in activities that used to bring pleasure. Beyond sadness, it often includes changes in sleep, appetite, energy, and concentration, and can affect how someone thinks about themselves and their future. The condition has been recognized in medical literature for centuries, though understanding of its biological and psychological roots has expanded dramatically since the mid-20th century, when researchers began studying the role of brain chemistry alongside life circumstances. Treatment typically combines therapy, medication, or both, depending on severity and the individual. Generalized anxiety disorder. This condition is marked by excessive, hard-to-control worry about a wide range of everyday things, from work and health to minor daily decisions, occurring more days than not for at least 6 months. The worry is often accompanied by physical symptoms like restlessness, muscle tension, fatigue, and trouble sleeping, even when there's no clear immediate threat. Unlike ordinary stress, which tends to fade once a specific problem resolves, this condition tends to shift its focus from one worry to the next without settling. It's one of the most common mental health conditions worldwide, and effective treatments include cognitive behavioral therapy and, in some cases, medication. Panic disorder. This condition involves recurrent, unexpected panic attacks, sudden surges of intense fear that peak within minutes and bring on physical symptoms like a racing heart, shortness of breath, dizziness, and a sense of impending doom. What distinguishes panic disorder from a single panic attack is the ongoing fear of having another one, which can lead someone to avoid certain places or situations altogether. Because the physical symptoms can closely resemble a heart attack, many people initially seek emergency medical care before receiving a mental health diagnosis. Treatment often focuses on helping the person understand the attacks are not dangerous, paired with gradual exposure to feared situations. Social anxiety disorder. This condition centers on an intense fear of being watched, judged, or embarrassed in social or performance situations, strong enough to interfere with daily functioning. It's more than shyness, since the fear often triggers physical symptoms like blushing, sweating, or a racing heart, and can lead to avoiding everyday interactions like eating in public or speaking up in meetings. The condition frequently begins in adolescence, a period when social evaluation feels especially high stakes, and without treatment, it can persist for decades. Cognitive behavioral therapy, particularly approaches involving gradual exposure to social situations, has shown strong results. Specific phobia. This condition involves an intense, persistent fear of a particular object or situation, such as heights, flying, needles, or certain animals, that is out of proportion to any actual danger. Exposure to the feared trigger, or even just the anticipation of it, can bring on significant anxiety or a full panic response, often leading to active avoidance that can shrink someone's world in surprising ways. Phobias are believed to develop through a mix of direct, frightening experiences, observed fear in others, and in some cases no clear identifiable cause at all. Exposure-based therapy remains one of the most effective and well-studied treatments available for this condition. Obsessive-Compulsive Disorder. This condition involves unwanted, intrusive thoughts called obsessions, paired with repetitive behaviors or mental rituals called compulsions, performed to reduce the distress those thoughts cause. Common themes include fears of contamination, a need for symmetry, or intrusive worries about harm, and the compulsions, like excessive hand-washing or checking, temporarily ease anxiety but reinforce the cycle over time. What separates this from ordinary habits or preferences is the significant time and distress involved, often consuming an hour or more of the day. Treatment typically involves a specialized form of therapy called exposure and response prevention, which helps break the obsession-compulsion cycle. Post-traumatic stress disorder. This condition can develop after exposure to a traumatic event, such as violence, an accident, or combat, and involves intrusive memories, nightmares, or flashbacks that make the past feel present. It also often includes avoidance of trauma-related reminders, negative shifts in mood or beliefs, and a state of heightened alertness that can make relaxation difficult. Not everyone who experiences trauma develops this condition, and researchers continue to study why some people are more vulnerable than others, including factors like prior trauma history and available support. Effective treatments include trauma-focused therapies that help the brain process the traumatic memory differently. Bipolar I Disorder. This condition is defined by the occurrence of at least one manic episode, a period of abnormally elevated mood, energy, and activity lasting at least a week, severe enough to disrupt daily functioning or require hospitalization. Manic episodes can involve reduced need for sleep, rapid speech, grandiose thinking, and impulsive decisions, and are often followed by depressive episodes that bring the opposite extreme. The condition tends to run in families, pointing to a strong genetic component, though environmental stressors can influence the timing and severity of episodes. Long-term treatment usually centers on mood-stabilizing medication, combined with therapy and lifestyle management. Bipolar II Disorder. This condition involves at least one hypomanic episode, a less severe form of elevated mood and energy than full mania, along with at least one major depressive episode. Because hypomania can feel productive or even pleasant, it's often under-recognized, and people frequently seek help during the depressive episodes without realizing the elevated periods are part of the same condition. This can lead to misdiagnosis as depression alone, which matters because the treatment approaches differ in important ways. Careful history-taking, often involving input from family or close friends, helps clinicians distinguish this condition from unipolar depression. Schizophrenia. This condition involves a combination of symptoms that can include hallucinations, delusions, disorganized thinking, and a reduced ability to function in daily life, typically emerging in late adolescence or early adulthood. Hallucinations, most commonly hearing voices, and delusions, or fixed false beliefs, are considered positive symptoms, while reduced motivation and emotional expression are considered negative symptoms. Understanding of the condition has shifted substantially since the mid-20th century, moving away from long-term institutionalization toward community-based treatment supported by antipsychotic medication. With consistent treatment, many people with this condition are able to manage symptoms and lead fulfilling lives. Attention deficit, hyperactivity disorder. This condition involves persistent patterns of inattention, hyperactivity, or impulsivity that interfere with functioning across multiple settings, such as school, work, or home. It typically emerges in childhood, though many people aren't diagnosed until adulthood, particularly those whose primary symptoms are inattention rather than hyperactivity, which tends to be less disruptive and easier to overlook. Brain imaging studies have shown differences in areas related to attention and impulse control, supporting the idea that this is a neurodevelopmental condition rather than simply a matter of willpower. Treatment often combines behavioral strategies with medication, tailored to the individual's specific challenges. Autism spectrum condition. This is a neurodevelopmental condition characterized by differences in social communication and interaction, along with restricted or repetitive patterns of behavior and interests. The term spectrum reflects the wide range of how it presents, from significant support needs to more subtle differences that may not be noticed until later in life. Diagnostic understanding has evolved considerably, moving away from a narrow view toward recognizing the diversity of experiences within the autistic community, including differences in sensory processing that were historically overlooked. Support approaches focus on building on individual strengths while addressing specific challenges, rather than pursuing a single standardized treatment. Anorexia Nervosa. This condition involves restriction of food intake, leading to significantly low body weight, combined with an intense fear of gaining weight and a distorted perception of one's own body. It carries one of the highest mortality rates of any mental health condition, largely due to the physical toll of malnutrition on the heart and other organs. The condition often begins in adolescence and can be reinforced by a cycle where weight loss temporarily provides a sense of control, even as the physical and psychological consequences deepen. Treatment typically requires a coordinated team involving medical monitoring, nutritional rehabilitation, and specialized therapy. Bulimia Nervosa. This condition involves recurrent episodes of eating an unusually large amount of food, paired with a sense of losing control, followed by compensatory behaviors like vomiting, laxative use, or excessive exercise to prevent weight gain. Unlike anorexia, body weight is often within a typical range, which can make the condition less visibly apparent and sometimes delay diagnosis. The binge-purge cycle tends to be driven by a mix of emotional distress and rigid beliefs about food and body image, and it can cause serious physical complications, including damage to the esophagus and electrolyte imbalances. Treatment often centers on a specialized form of cognitive behavioral therapy designed specifically for eating disorders. Binge eating disorder. This condition involves recurrent episodes of eating large amounts of food with a sense of loss of control, without the regular use of compensatory behaviors seen in bulimia. Episodes are often marked by eating rapidly, eating until uncomfortably full, and eating alone due to embarrassment, followed by intense feelings of guilt or shame. It's now recognized as the most common eating disorder, though it was only formally classified as its own diagnosis relatively recently, after years of being viewed simply as a lack of self-control. Treatment approaches include therapy focused on the emotional patterns driving the behavior, alongside medical support for related health concerns. Borderline personality disorder. This condition is characterized by a pattern of instability in relationships, self-image, and emotions, along with marked impulsivity that begins by early adulthood. People with this condition often experience intense emotional reactions, a deep fear of abandonment, and rapid shifts in how they view themselves and others, sometimes idealizing then devaluing the same relationship. The condition has historically been stigmatized and misunderstood, though research has increasingly linked it to a combination of genetic vulnerability and early relational or environmental factors. Dialectical behavior therapy, developed specifically for this condition, has become one of the most well-supported treatment approaches available. Narcissistic personality disorder. This condition involves a pervasive pattern of grandiosity, a need for admiration, and a lack of empathy for others, present across many areas of life. Underneath the outward confidence, many clinicians observe a fragile self-esteem that is highly sensitive to criticism, which can trigger defensive or even hostile reactions when the person's self-image feels threatened. Because the traits themselves often make someone resistant to seeking help, this condition is diagnosed less frequently than many others, and treatment usually depends on the person recognizing that their relationships or functioning are being negatively affected. Long-term therapy focused on building genuine self-awareness tends to be the primary approach. Antisocial personality disorder. This condition involves a long-standing pattern of disregard for the rights of others, including behaviors like deceitfulness, impulsivity, irritability, and a lack of remorse after causing harm, with roots often traceable to conduct problems in childhood or adolescence. It's distinct from simply being unkind or self-interested, since the pattern is persistent and pervasive enough to consistently violate social norms or laws. Genetic factors, early environment, and childhood experiences of neglect or abuse are all thought to contribute, though the exact combination varies from person to person. Treatment is challenging, since the traits themselves often reduce a person's motivation to change, and outcomes tend to improve most with early intervention. Dissociative identity disorder. This condition involves the presence of two or more distinct personality states, along with recurring gaps in memory that go beyond ordinary forgetfulness, often affecting personal information, daily events, or traumatic experiences. It's strongly associated with severe, repeated trauma during childhood, with dissociation theorized as a protective mechanism that allowed a child to psychologically separate from overwhelming experiences. The condition remains one of the more debated diagnoses in the field, partly due to its rarity and the challenge of studying it, though most trauma specialists view it as a genuine and severe response to early adversity. Treatment is typically long-term, focusing on safety, stabilization, and gradually integrating fragmented aspects of identity and memory. Insomnia disorder. This condition involves persistent difficulty falling asleep, staying asleep, or waking too early, occurring at least 3 nights a week for 3 months or more, along with significant daytime distress or impairment. Unlike an occasional restless night, this condition often develops a self-perpetuating pattern where anxiety about not sleeping itself becomes a major barrier to sleep. It can exist on its own or alongside other mental health conditions like depression and anxiety, and untangling which came first is often an important part of treatment. Cognitive behavioral therapy for insomnia, which addresses both sleep habits and the thoughts fueling sleeplessness, is now considered a first-line treatment, often more effective long-term than medication alone. Substance use disorder. This condition involves a problematic pattern of using alcohol or drugs that leads to significant impairment or distress, including symptoms like increased tolerance, withdrawal, unsuccessful attempts to cut back, and continued use despite clear negative consequences. It exists on a spectrum from mild to severe, and modern understanding frames it as a chronic brain condition rather than a simple failure of willpower. Since repeated substance use physically changes brain circuits involved in reward and self-control, genetics, environment, and mental health history all play a role in vulnerability, which is part of why this condition so frequently occurs alongside other mental health diagnoses. Treatment approaches range from outpatient therapy to structured programs, often most effective when they address co-occurring conditions at the same time. This video is intended for educational purposes only and does not constitute a diagnosis or medical advice. If you or someone you know is struggling with a mental health condition, please reach out to a licensed mental health professional or your doctor.